What's 75 for a slice? The new tinctures. That's pretty much what it costs. I do apply for if you do meet different criteria in New Jersey. Belmar does give discounts, so 10 and 20% gets taken off for patients right away. I just got an email today. Brand new strain, blueberry Tahoe, blueberry and Tahoe OG, little indica dominant. But it's also telling me what's on sale this week, which is Agent Orange and Blue Dream.
And that comes in an email?
This comes through an email to the patients that are certified on the system
Wow.
with my dispensary. It's private back and forth. If I want to go further, I can go ahead and get my prices together and know what it is I want before I even walk in the door.
Yeah.
Is that every dispensary? Or is that
I'm sorry, my own experience is with
Belmar.
Passion Sciences right now in Belmar,
That's it.
New Jersey. They've really, it's a showroom. Of the flower that's available, there's a dozen and a half, going on 2 dozen different strains that are available. And everyone's open for discussion, not only on CBD and THC, but which CBD, CBG, CBA, and what the percentages are. With testing in New Jersey, it's done by the state, and I noticed that it's the same numbers every time. They just do it once a year,
Yeah.
and then print it up. Some of the new things coming along, we just got the extractor online in June or July. We'll have that available. It's the first non-flower product available.
Yeah. In all of New
Okay.
Jersey or
In all of New Jersey.
Wow.
Okay, and to jump over, yes, and one of my friends took the tincture and took one of these and went online and said, yes, you can.
Yeah.
But again, that's an
Thank you so
outside
much,
issue.
Michael.
Thank you.
Thank you. Dr. Huang?
Hi, so my experience is more strictly by the book. So I'm a nephrologist, so I take care of medications, dosing, titrations, interactions, everything that goes through kidneys. That's where I see medical cannabis. Anything that that's a little bit fuzzy or maybe, gray in terms of the laws, I go, my physician's oath, Hippocratic oath, and also by what I know as a physician and using my clinical judgment, and also adding the piece of, look, these are patients who, I'm not here to judge them on their suffering and their pain. I'm here to, qualify them from the conditions, so working within the lines of what the law is now. If there's change, that's being done, going to Albany, that's great, but also, I also appreciate what the registered organizations are. You have to work within the lines, and then you move the needle,
Yes.
shift it, step by step. So,
Right.
Right now, the medical cannabis with physicians, I think, is an important one, in terms of trying to make it as legitimate as possible so that you don't have that stigma attached to it. I mean, I make it very simple, for patients. I have a pamphlet so that they can show their physician. So if they themselves are not comfortable with the recommendation or prescribing, other medications that are as an adjunct to it, I have that there. They can always give me a call. Bernie's here and, other physicians, and if they want names of people in their location, I have no problem looking that up. I also, and I just showed this to one of the patients, is that I also put in the packet that I give patients a template of a letter that they can give to their physicians and say, and really absolving them of any responsibility. So, and I have extra copies basically saying, put it on your letterhead. If you, they give the documentation of the diagnosis, symptoms, you need that for the, medications that, I would want them to come to my office with. If they don't have, like say, for example, a pathology report or a biopsy or, NCV test or something, I would also accept a letter from their physician saying, yes, I've been treating this patient for so and so and so. And I have it so laid out for them that I've basically given them the template. All they have to do is put on their letterhead and
Yeah.
sign the name.
That's great.
Or a progress note. I mean, something where I can say that this is their diagnosis, this is my documentation, and then we can move on from there. I also do a saliva drug screen in my office, same day. I mean, again, this used to be a longer process. Now I've cut it down to with giving patients my packet of all the laws, where the registered organizations are. I give them, and I have sort of the hard copy here so that if anyone wants to take a look.
Great.
I also show them a pain scale from 0 to 10 so I can monitor them from where their pain was before to where they are now and how it's working so that the next time I see them, I can adjust the dosing. So do they need, and I know, and the pharmacists at the registered organizations also work in conjunction with us. Sometimes they know exactly, they know their products better than I
Sure.
would know their products, and also they see the patients maybe more often than I do, but we work together. But also in terms of the symptoms, is it chronic pain? Do you need, breakthrough pain? Do you need, what are your side effects? So you have to work around the products they have, which are limited.
Yes.
Which is, I'm sure it's going to expand in the future, but you have to be a little bit creative in terms of the dosing. That's the art of medicine. And that's what our jobs are for, is to try to work with what we have now, what the laws are, and then navigate around it, all doing it lawfully and responsibly, but also compassionately.
Makes sense.
And, again, I put, my piece in terms of, coming to the doctor's side, our piece is a little bit entailed. Their process to getting to the doctors are entailed.
Right.
But when they get to, say, you're someone who knows how to do this, I submit it to the Department of Health. It might take a little bit, but I'm pretty good with the computer at this point.
Sure.
And I have the Department of Health IT on my speed dial, like, hi, it's Dr.
It's me
Huang
again.
And we work through it. Or sometimes I've had them set up, where they can take control of my computer, and I had the people who were very early on, who had a lot of, glitches, and then they would learn from me. And I've also told them, for example, there's a glitch where if you do a refill, the date on the signature on the second recommendation is still the initial date, and I told them that was a problem from a long time ago.
Yeah.
So and then when they get to the dispensary, or the registered organization, then there's that piece which I walk them through as well. So it seems like it's very complicated, but you also need to, find a person who knows, what they're doing and is willing to put in the legwork. I've gone to the registered organizations, to the site themselves, so I know exactly, and I've talked to, a number of people here, so I know exactly what I'm doing with. So it's not the test that's a difficult part. It's really how much effort does your physician want to make to really go the full distance. And really, I was looking at it just from the medical piece, as my sister actually had cancer, and so this is my sort of motivation to do this. But that's the easy part. The rest of it is going the full measure to make this so not just the medical part, but now there's the noise around it, the social part, the political part, which I think as a physician you just want to stay in this little sector, but as I try to push this forward for my patients, the only way I can do that is to really reach out to places that are already accepting it, and then I can maybe get back into it. But that's the only way to do it, because we are right now the bottleneck.
Well, thanks for doing that, Dara.
Yeah, thank you. So we'll do real quick, just got a couple of fun raffles to raffle off. Do you have the bag? So first and foremost, we wanted to raffle off 5 tickets to the National Cannabis Industry Association Caucus. National Cannabis Industry Association is the oldest, I believe, industry association. They are a national organization, and they will be having their quarterly caucus here in my office on October 18th. The ticket value is $50, and so they've graciously allowed us to raffle off 5 of those tickets. Todd, you want to pick 5 tickets?
All right, here we go, kids. You all got your tickets
This
ready,
is going to be a great
right?
event. They'll have food and networking. Other industry professionals will be there as well.
The last 3 numbers on ticket number 1 is 017.
Yay!
Yay! Come on down.
Write down the names. We will send you an email with that information.
Winner number 2, 020. All right! Oh, this is cool. Little James Bond or 007. Stand up.
Right after me.
Anybody? 007?
Jamie, were you after me or before me?
No one's got 007?
Take it away.
You were before me.
401.
I'll trade you some tea for one.
Oh, is that right? Or is it ripped out? Oh, it's 016. Sorry.
Yay! Put your name on that list. Yep. Yep.
005.
Would you rather come to give up your tea?
I'd love to.
005, nobody? Oh, come down. Man, you're winning
All
good
right,
today.
well, all of our ROs will be here.
And the last number, 019.
I think that's only 4 people. 5 people. You guys will be coming together.
Congratulations.
We're gonna give up one.
Oh.
We'll get an extra.
We'll get it out.
That's okay. Okay, so Michael gave up his tea, so we have one more tea package.
Okay, here we go, tea package.
Write down Michael's name too, we'll get him in.
I'll give something away tonight if you want. 010.
010, hemp tea.
No winner? Next
No,
winner.
no, there's no 010.
008.
008.
Nobody.
Eric!
Oh.
Nice.
Okay, now this is the special prize. Who's got 003? You, come on down. All right. Thanks everybody for showing up. I'm gonna give a special edible.
Okay, so that's
That's outside.
That can happen afterwards.
Yeah.
You can
That's not
interpret
part
that
of
later.
CCA.
Right. Oh, Sarah.
That's his personal raffle. You can take care of that
That's
separately.
a Hinden raffle.
All right, and then
Sorry.
we have, so one of our sponsors that we've been working with is a company called Evokes. They
Evokes.
make a wonderful CBD pen. This is 50 state legal at CBD. It's an isolate from Switzerland. They retail for $40 each online, and we are raffling them off today.
Yes.
And
We also have them for sale for $20 each.
Thank you.
Yes.
And talking about CBD, CBD always gets sold out, so I recommend that you try this pen. It's amazing and it's very delicious.
And normally CBD tastes like garbage, but we have 4 essential oils that
Yes.
are very refreshing and very natural. We have tangerine, we have ylang ylang, we have geranium, we have frankincense.
they're all mixed in.
First winner is 002.
002, where are you?
Really? All right. And the second one is 014. Wow.
Hey, right on.
All came together.
All right, the hat too?
Yeah, and we have a hat.
Best,
Oh,
the best
one more?
raffle of all.
Hat.
Thank you for supporting the Cannabis Cultural
I've been
Association.
looking for it.
And the magic winner is 004.
Absolutely.
That's right.
Well, folks, this has been a really great evening. We really appreciate you coming and buying tickets and supporting our organization. If we can just give a round of applause to our panelists. Please ask you to move into the other room. You're welcome to stay and talk with our panelists, but we're going to try to set up this room for tomorrow.
Thank you for
Thank
tonight.
you so
We are
much.
Cannabis culture.
Yeah, I want to get a group of all of us together.
Absolutely, yes.
Great, yeah.
All right.
Todd, can you turn this off?
It's oh, you want to
Wish you good.
Just hit that button.
Okay.